Good day, students. My name is Oluremi Olurantilonge. I'm going to be taking you on TAU NSC 527, Dental Nursing. Dental Nursing. By way of introduction, the evolution of dental nursing dates back to the late 19th century when dentistry began to advance as a specialized field of medicine. Florence Nightingale, renowned for her contributions to nursing, recognized the need for trained dental nurses. In 1859, Nightingale established the first dental nurse training school at the Royal Dental Hospital in London, England. These early dental nurses were often referred to as lady dentists or dental nurses. Dental nurses have played a vital role in supporting the dentist in providing high-quality patient care for many years. They also work closely with the dentist to ensure that the surgery is well maintained and that all necessary equipments are available. In recent years, the role of dental nurses has expanded to include new areas such as oral health promotion and the provision of dental care in community settings. Currently, dental nursing is a regulated profession and all dental nurses must register with the General Dental Council, GDF. Dental nursing is a profession with a rich history and a bright future. And as dental care continues, the role of a dental nurse is likely to expand further, providing new opportunities and challenges for those who choose to pursue this fulfilling career. Six stages of tooth development. There are 6 stages of tooth development, starting from the dental lamina formation that begins from the 6 to 8 weeks gestation through bell stage, that is the 11 to 12 weeks of gestation, to the dentin formation stage. This is the anatomy of a tooth, showing the cross section with associated structures. Functions of the teeth. The main functions of the teeth include chewing food into a bolus that can be easily swallowed or for further digestion, giving structure, tissue support and shape to the face, aiding in the pronunciation of sounds during speech. The incisors are used for cutting and biting, the canines are used for gripping, as well as the premolars and molars are used for grinding. Assessment of the conditions of the teeth. History taken from the patient before physical examination is carried out. The assessment starts with physical examination of the patient or client's face for asymmetry, for masses and skin lesions. The teeth are inspected for the shape, the alignment, defects, mobility, the color and presence of adherent plaque, material harbor, that is dead bacteria, food debris, discoamated epithelial cells and calculus, that is tartar. Teeth are gently tapped with a thumb depressor or a mirror handle to assess the tenderness, that is the percussion sensitivity. Common problems of the teeth. Common problems of the teeth are, but not limited to, tooth decay, gum disease, crooked teeth, sensitive teeth, cracked or broken teeth, receding gums, root infection, enamel erosion, lost crown, teeth grinding. Congenital disorders of the teeth. Congenital disorders of the teeth. The abnormalities of the teeth of the tooth number. They are anodontia, which is characterized by a total lack of tooth development. Hyperdontia is characterized by an increased number of teeth. Hypodontia is characterized by the developmental absence of one or more teeth. Another group of abnormalities is abnormalities of the tooth size. Abnormalities of the tooth size. Microdontia is characterized by teeth that are smaller than average size, often accompanies other systemic syndromes like congenital growth hormone deficiency, orofaciodigital syndrome, etc. Macrodontia is characterized by teeth that are larger than the average size, and it occurs in pituitary gigantism and pineal hyperplasia. Ectodermal dysplasia. Ectodermal dysplasia. Teeth are absent or conical in appearance so that from childhood partial dentures are needed. Dentinogenesis imperfecta is caused by a dominant genetic defect which affects both the deciduous and the permanent dentition. Causes of dental disorders. Causes of dental disorders. Some of the causes are smoking, poor oral hygiene, xerostomia, certain foods and drinks, especially sugary foods and drinks, genetics. Conditions like lowered immunity, for example, leukemia, HIV and AIDS, cancer treatments, that is chemotherapy, hormonal changes, inadequate nutrition, age, diabetes mellitus, medications, and tooth location. Medical treatment of teeth conditions. Depending on the cause of the problem, treatment ranges from proper brushing techniques, dental bridges, use of porcelain veneers, crown, or the use of tooth-colored filling, dental bonding, teeth whitening, teeth braces, dental implants, dentures, uses of braces, prescribed medication. Nursing care of patients for surgical dental conditions. The perioperative care. Assess the patient's history, allergies and medications, ensure patient understands procedural risk and benefits, ensure the concept of the patient is obtained, prepare patient for anesthesia and surgery. Post-operative care. Monitor vital signs, pain and swelling, promote wound healing, prevent infection, and then bleeding management. Prevention of teeth conditions. How do we prevent teeth conditions? Adequate diet, use of fluoride toothpaste, dental floss, oral hygiene, seeking professional care every 3 to 12 months, avoid tobacco products, eat crunchy fruits and vegetables, scrub your teeth gently, use of mouthguard during sporting activities, and so on. Primary health care implications of dental nursing. Preventive care, early detection and referral, chronic disease management, health promotion, community outreach, collaboration with other healthcare professionals, patient education and empowerment, quality improvement, public health, research, and evidence-based practice. This is a diagram of a teeth showing the location of each of the types of teeth. We have the I for the incisors, C for canine, P for premolar, and M for molar. And this is another diagram showing a tooth where the crown is shown starting from the tip, that's the enamel, that's the crown, then the neck in the middle, and the root down. This is another diagram showing the types of teeth and their location in the buccal cavity or the mouth. Stages of caries development. This diagram depicts the development of caries, a disorder of the teeth, starting from enamel caries to dentin caries, pulpitis, and periodontitis. The pathophysiology of dental caries. Dental caries, better known as tooth decay or cavities, is a multifactorial disease that leads to demineralization of the teeth and subsequent areas of decay or holes. Symptoms of tooth decay include pain, infection, and tooth loss. In the United States, the dental caries is the most common chronic childhood disease, 5 times more common than asthma. Dental caries result from the activity of bacteria on the teeth, most commonly Streptococcus mutans. In the development of dental caries is the deposition of plaque on the tooth, a film of precipitated products of saliva and food. The bacteria which inhabits plaque depend greatly on carbohydrates for activation and multiplication. These bacteria also form acid, that is lactic acid, and proteolytic enzymes, which cause caries due to the now highly acidic environment dissolving the calcium salt of the teeth. The human dentition. Most adults have 32 permanent teeth, but some people are born with missing teeth hypodontia, and some have extra teeth, hyperdontia. Most children have 20 primary teeth that grow or erupt between the ages of 4 months to 6 years old. These are baby teeth that eventually fall out and make room for permanent teeth. This is another diagram showing the temporary and the permanent teeth. What are dentures? Dentures are removable oral appliances that replace missing teeth in the upper jaw, the lower jaw, or both. Dentures are made from materials like acrylic, resin, nylon, metal, and porcelain. The types are full dentures, partial dentures, immediate dentures, implant to retain, and implant supported. Proper care and maintenance help keep dentures in good condition. Here are a few general guidelines to make sure the appliance lasts as long as possible. Remove the dentures at the end of every day. Clean the dentures using a denture brush and paste. Soak the dentures overnight in a denture solution. Brush the gum, teeth, inner cheeks, roof of the mouth, and any remaining tooth twice a day to remove plaque and debris. Psychosocial implication of dentition and dental conditions. Individuals who have poor chewing skills or difficulty with verbal and emotional communication due to poor oral health may experience a decrease in self-confidence, which predisposes them to loneliness. Self-esteem is more of a psychological concept. Therefore, even the common dental disorders like dental trauma, tooth loss, and untreated caries lesions may affect the self-esteem, which may further influence the quality of life of an individual. Economic implications of dentition and dental conditions. Productivity losses, medical costs, lost economic opportunities, impact on nutrition and overall health, healthcare system burden, impact on education and cognitive development, and increased healthcare costs. Nursing models used in managing teeth conditions are the health belief model, theory of reason action, theory of learned behavior, social learning theory, and the behavioral change wheel. In conclusion, there is a need for dental health planners and policymakers who have the relevant qualifications and treatments and training to understand the unique needs and resources for the development of an effective policy for dental care. And there is a vast difference in the oral health status between urban and rural populations and developed countries. These are my references. Thank you so much for listening. I will implore the students to avail themselves the opportunity of accessing these resource materials as and when due, and familiarize themselves with the contents of a note therein in order to prepare well for this course. Thank you for being in class. See you next time.